Hi, I'm going to be talking about the causes of lupus today. So, the cause of lupus is actually unknown, but researchers believe that could be due to genetics, hormones, and specific environments. Usually, the immune system protects you from bacteria and other foreign invaders that can make you sick. However, if you have lupus, your immune system mistakenly attacks and damages your body's own tissues. People could be born with a gene that makes it more likely for them to have lupus. And then if they're exposed to something in their environment, then this triggers the disease. Researchers have found over 50 genes that are associated with lupus. However, sometimes you could have the gene and the environmental trigger and not have lupus. This is why it's so hard for researchers to figure out what causes lupus. Environmental triggers include UV rays from the sun or fluorescent light bulbs, sulfa drugs, which makes a person more sensitive to the sun, such as diuretics, sun-sensitizing tetracycline drugs such as minocycline, antibiotic drugs, infection, cold, or viral illnesses, exhaustion, emotional stress, or anything that causes stress to the body in general. This could be something like surgery. The only thing that researchers are positive about that makes it more likely for you to have lupus includes genetics, your gender, your race, and previous illnesses. So genes and lupus. This is just a picture of a gene right here. And again, scientists haven't found any one gene that causes lupus, because like I said before, there were 50 genes found that are associated with lupus. People with lupus, though, are more likely to have changes to the genes that help their immune system recognize and respond to viruses and other germs. Lupus most likely runs in families. This means if your parent, brother, or sister has lupus, then you have more of a chance to get lupus. And this chance is about 1 to 5%. The ethnic groups that are more likely to have lupus include African Americans, Asians, Hispanic or Latinos, Native Americans, Native Hawaiians, and Pacific Islanders. Additionally, there was a link between women and lupus. So researchers believe that the hormone estrogen might play a role in lupus because 9 out of 10 people who have lupus are female. Men and women both make estrogen, but women make much more of it. The connection, though, is that estrogen helps make women's immune system stronger than men's, so this hormone can either help trigger lupus or make it worse. Some women with lupus could get symptom flare-ups around their period or during pregnancy when estrogen levels are higher.
And I'm going to discuss the symptoms of lupus. Lupus can affect almost any organ in your body. Symptoms will differ from person to person. Over time, new symptoms can develop or some may disappear. Lupus is a disease of flares and remissions, meaning that at some point in time, your symptoms may be manageable or less noticeable. And then other times you may have flare-ups where your symptoms are very noticeable. The first symptom is muscle and joint pain. This can occur with or without swelling, and the most common places are in the neck, thighs, shoulders, and arms. The second symptom is fever. A fever is going to be caused by inflammation or an infection. And in this case, a fever is considered anything over 100 degrees Fahrenheit. The third symptom is rashes. You're going to get rashes in the most places that are exposed to the sun. So like your face, your arms. And the most common type of rash is a butterfly-shaped rash that occurs over the nose and the cheeks. The fourth symptom is chest pain. This is going to be caused by inflammation in the lungs. It's going to feel like a tight chest, and it might be a little bit difficult for you to breathe. The fifth symptom is going to be hair loss, and this is most likely caused by medication, so this is more of like a side effect. The sixth symptom is sun sensitivity. Photosensitivity, it's like photosensitivity is when you're going to get a reaction from being in the sun too long. So your skin is going to be highly sensitive to the sun. So you're going to get rashes, a fever, and most people feel very fatigued. The seventh symptom is kidney problems. Kidney problems with lupus, they call it lupus nephritis. You'll notice a weight gain, swollen ankles, high blood pressure, and decreased kidney function. The eighth symptom is mouth sores. You're going to find ulcers on the roof of your mouth. The 10th symptom is anemia. You're not going to get enough red blood cells to carry enough oxygen, so it's going to cause the person to become anemic. The 12th symptom is blood clotting. This can occur in the legs and the lungs. This can also lead to a stroke, a heart attack, or miscarriages. And the last symptom is eye disease. People with lupus experience dry eyes, dry inflammation, and eyelid rashes.
Today I'll be going over the diagnostics of lupus. Lupus is an autoimmune disease, which makes it pretty hard to find clear-cut imaging or testing to find, and it has to be clear to patients that there is no way to clearly tell if you have lupus, and it can take some time for a diagnosis to come. I know symptoms can be hard, and that's something you have to explain to them, but there is no clear-cut way to be absolutely certain that it is lupus. But when looking at a patient with symptoms that are lupus-like in nature, you have to order blood tests. There's a few different ones: a urinalysis looking at what the kidneys are putting out, a tissue biopsy looking at different markers, which we'll talk about, and possibly even imaging, which shows similar things to the biopsy. One of the major indicators of lupus is finding out if you have a familial history. This is really important to the physician, especially because looking at your genetics can have a very beneficial role in treating your lupus, depending on what kind it is. Looking specifically at your genetics can help a doctor know if there is a history that he should be looking for in mutations. So when looking for lupus in a patient based on their symptoms, these are some of the things that'll be ordered, mostly in this order, but it can vary depending on which kind of physician diagnosed you, whether it's a rheumatologist or just your family physician. So the first thing that'll definitely be ordered is a complete blood count. It looks at like the makeup of your blood, basically just doing a general scan of what's in your blood. So it's looking for the level of red blood cells, white blood cells, platelets, and what is in the serum or the fluid that is your blood. So many patients have issues ranging from anemia to increased blood clotting. Anemia is when there's low red blood cells, which have hemoglobin, which is responsible for carrying blood. Excessive blood clotting would be caused by an increased level of platelets, which is called thrombocytosis. And then there's also the chance of decreased white blood cells or platelets in the blood. Another thing that they'll be looking at is your antibodies. Specifically, they'll be looking for your ANA or your anti-nuclear antibodies. And most patients, about 97% of all patients with lupus, have a positive ANA test. Though having a positive ANA test does not mean that you have lupus clearly. Another test that will be ordered is a urine test, and lupus will commonly attack the kidneys, so it's looking for the function of the kidneys, and it's looking specifically for proteins and cast cells, which is a sign of inflammation of the kidneys, which then will be followed up by a biopsy. And most common biopsies are done in lupus patients for looking at the skin and the kidney tissue or the renal tissue, specifically looking for inflammation and damage caused by the inflammation.
Okay, now I'll be talking about treatments for lupus, and unfortunately there is no cure, so we can only treat the symptoms. To reduce pain and swelling in joints and muscles, NSAIDs are typically used. Those are the non-steroidal anti-inflammatory drugs like aspirin, ibuprofen, Aleve, Tylenol. There are also corticosteroids that are used to reduce swelling, tenderness, and pain. And now, because lupus is an autoimmune disease, corticosteroids help suppress the immune system, which will calm some of the lupus symptoms. But unfortunately, it is a steroid, so the patients cannot be on them for too long, and they must be slowly weaned off. They can't just quit cold turkey. Interestingly enough, antimalarials are also used because they will help treat joint pain, skin rashes, fatigue, and lung inflammation. So the hydroxychloroquine and chloroquine phosphate are both used, and they will help stop lupus flares, and they will actually increase the longevity of the patient. Now, immunosuppressive agents are used, such as chemotherapy, but they're only used in very severe cases when other treatments don't work. Obviously, they are going to suppress the immune system, which is helpful in autoimmune disease, but we have to make sure that they do not suppress the immune system entirely and make it so that the body cannot fight off any infection. Now, BLYS-specific inhibitors are also used to treat lupus. The one that I focus on is the belimumab, and that is an immunosuppressive agent because it reduces the amount of abnormal B cells. But let's take a look at how it works. This nice diagram right here really does a good job at showing what goes on. So here's the BLYS little signaler, and here is the receptor on the normal B cell and the autoreactive B cell. So when it binds, normal B cells just do what they're supposed to do. But here in the autoreactive B cell, it causes inflammation and autoantibodies, which means antibodies against the body itself, which we do not want. So here you see the belimumab is actually going to bind to the signal so that the signal cannot bind to the receptor. Now, because there is the reduced BLYS signaling, it actually leads to apoptosis in both normal and abnormal B cells. One fun fact about belimumab is when it was being studied, it was noted that African Americans and people of African descent do not respond to this treatment as well, if at all, as other people. So that is just something to consider when treating patients. Lastly, we have anticoagulants, so they're going to prevent blood clots. Many people worry about this with lupus. This picture is depicting Coumadin versus warfarin. Coumadin is just a brand name of warfarin, and both warfarin and heparin are common anticoagulants prescribed to lupus patients. Warfarin, as you can see, is a pill or a tablet, and heparin is actually an injectable. So although there is no cure for lupus, there are many treatments that help make it more manageable and hopefully make the patient's life a little better with less symptoms.
First, I have statistics on lupus. So the Lupus Foundation of America estimates that 1.5 million Americans and at least 5 million people worldwide have some form of lupus. And lupus strikes mostly women of childbearing age. However, men, children, and teenagers can get it too. So it's not just strictly for women. 90% of people living with lupus, however, are women. Most people with lupus develop the disease between the ages of 15 and 44, and based on available data, there are an average of 16,000 new cases of lupus per year. Research shows that lupus is 2 to 3 times more prevalent among women of color, so women of African American descent, Hispanics, Latinos, Asians, Native Americans, Alaska Natives, Native Hawaiians. They are more likely to get lupus than Caucasian women. Recent research also indicates that lupus affects 1 in 537 young African American women. And then one study called the Lumina, which stands for Lupus in Minority Populations, Nature versus Nurture, reported that African American lupus patients are more likely to have organ system involvement, more active disease, and lower levels of social support compared with Caucasian lupus patients. A 2014 study found that minority women tend to develop lupus at a younger age, experience more serious complications, and have higher mortality rates. And in my research, I found that there is a lack of awareness for lupus. So while lupus is a widespread disease, awareness of the disease lags behind many other illnesses. 63% of Americans surveyed have never heard of lupus or know little to nothing about the disease or its symptoms, other than the name And then over half of the respondents, so 61% of the people surveyed, believed it takes 6 months or less for a person to be accurately diagnosed with lupus, which significantly underestimates the time it really does take for an accurate lupus diagnosis.